This is Lubab El-Hadi, and today I am talking about COVID-19 vaccines for children and what do we need to know. And we here, I mean, whether we are parents trying to make the right decisions for our children and want to feel more comfortable about the decision that we are making for them, or we are just people working in the healthcare field and getting a lot of questions about the COVID vaccines and need to have more information in order to answer these questions in a scientific way and with data. Or we are just regular people and want to have respectful discussion about vaccines with others, especially with the hesitancy that we are seeing about this subject. The most important thing that we are seeing in this pandemic, which is different from all other times before, is open data. And the potential role of open data in mitigating COVID-19 and in the fight against this virus. So here we are trying to get the benefit of this fact that the open data that we are having. And since this presentation is concentrating on the vaccines for children, so we are trying to talk here about the most important data that can be related to vaccines for children. And this will include data about the incidence of COVID-19 in general, comparison of COVID-19 incidence with other viral infections, hospitalization rates, mortality rates, multisystem inflammatory syndrome in children, MISC, which is the most serious complication that we have seen with COVID-19 infection, vaccine efficacy and effectiveness, safety of the vaccine, and myocarditis rates. And myocarditis is the most serious complication that has been reported with mRNA vaccines in general, whether it is Pfizer or Moderna. So the myocarditis rates data is also important for us. Here in this chart, we see the number of child COVID-19 cases added by week. And this is till the week of October 14. So as we can see, the average is different. The beginning of the pandemic, we have low rates, maybe by 6,000. And now we have more than 100,000 a week of child COVID-19 cases. The highest, we see them after the holiday season last year, and also the beginning of this school year in August and September. We saw the highest levels of child cases. And this chart is by the American Academy of Pediatrics. This chart is showing the cumulative number of child COVID-19 cases till October 21st, 2021. The cumulative number is more than 6 million cases. 10 states reported more than 200,000 cases. California is in the first place, followed by Florida. Texas is not in this chart. One state reported fewer than 10,000 child cases, which is Guam. This chart is also showing child COVID-19 cases added by week, by region. So we can see that the highest level was in the southern region of the United States, and also this chart is from the American Academy of Pediatrics. This chart also is showing the number of COVID-19 cases of children and adults, and showing the percentage of the children cases from the total cases. So we can see from at the beginning of the pandemic, the percentage was as low as 2.6%. And now in the week of October 14, we have a percentage that is higher than 25%. That means that quarter of the cases now are children in the United States. Here we can see also numbers, but this percent, as you can see here, is the cumulative percent, which is different from the percent that we have seen in the previous slide, which was the percent weekly of child cases compared to adult cases. But here we have the cumulative percent of children cases from the total cases. So I just chose randomly different weeks in the last 3 months, and we can see that actually the percent is increasing. In August it was 14%, and now we are over 16% in October. So again, this is the cumulative percent, and the other numbers are cases per 100,000 children, and we see that how the cases are increasing. Here we have the COVID-19 associated cumulative hospitalization per 100,000 children and adolescents by age group. So we have the age groups of children divided as 0 to 4, 5 to 11, 12 to 17. The highest rate of hospitalization we can see here is in children 0 to 4 years old, followed by 12, 17, and then 5 to 11 years old. Now we are going to talk about different type of data. So all the previous slides showed data about COVID-19 incidents and different types, but here we are going to talk about COVID-19 data in comparison with other viral infections, and this chart is comparing COVID hospitalization rate with influenza hospitalization rate, also among age group 12 to 17 years old. And we can see here that for the influenza we have 3 years, 3 seasons, 17, 18, 18, 19, and 19 and 20. Of course, for COVID we have only 2020, 2021. So we see how the COVID-19 hospitalization rate is significantly higher than the 3 seasons of influenza, the last 3 seasons of influenza. Here we are having also another data in comparing COVID with other viral illness, and here is comparing pediatric hospitalization and death in US, and it is in pre-vaccination of course for COVID. So we see that the virus hospitalization rate for COVID is 22 per 100,000, which is like in 1 year, if we can say. The death per year is 322. For influenza, if we see the death rate, so we see that it is in 4 years we have 110 to 192. So this can show like the difference is the COVID-19 is significantly higher. For the varicella, we see that we have 50 deaths in 24 years. The hospitalization rate is 4 to 13. Rubella death is 17 in 2 years, which was in the 60s. Hepatitis A, 3 in 5 years. The death and the hospitalization rate is less than 1. Rotavirus has the highest incidence, which is 1,500 cases, especially in children under the age of 5. But at the same time, we see that the death rate in 8 years is from 20 to 60. So this can show that COVID is a deadly virus actually compared with other viral infections, as we can see from this table. Now we are going to talk about multisystem inflammatory syndrome, or MIS, and for children it is called MISC. Multisystem inflammatory syndrome, or MIS, is a rare but serious condition associated with COVID-19 in which different body parts become inflamed, including the heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. MIS can affect children, so it is MISC, or adults, so MISA. MISC case definition includes people who are under the age of 21, and the CDC is tracking the data for MISC and MISA. The cases reported to CDC on or before October 4th, 2021, we have the total number of MISC, we are talking here, is more than 5,000, and the total death is 46. This is the data from the CDC, again, before or on October 4th, 2021. And now we are going to talk about the most serious complication that was reported after vaccination, which is myocarditis for children. We are talking about vaccination for children, and it is the inflammation of the heart muscle. And also we have pericarditis, which is inflammation of the outer lining of the heart. In both cases, the body's immune system causes inflammation in response to an infection or some other trigger. The cases of myocarditis reported again was all after mRNA vaccination, which is either Pfizer or Moderna, and it was especially in male adolescents and young adults, more often after the second dose, usually within several days after vaccination. Most of the patients recovered after getting a treatment, and it is recommended to follow up with cardiologist after that. This table is having two types of data that we want to cover. In this table, we are going to see data that shows the effectiveness and the efficacy of the vaccines, and at the same time, it also will show the myocarditis rates expected. So this table by the CDC is showing per million vaccine doses administered in each age group. And since we are concentrating here on the vaccines for children, so I will just mention here the age group 12 to 17. And of course, we still don't have data for the younger ages because we are just starting to get the vaccines for this younger group. This table is for the male population. So the benefits is COVID-19 cases prevented for this age group was 5,700. Hospitalizations prevented 215. ICU admissions prevented 71. Death prevented 2. And again, we are talking here about data for per million vaccine doses. The harms, myocarditis cases expected in this age group, it is from 56 to 69. In this table, it is also the same, showing data of the effectiveness of the vaccine per million vaccine doses, but it is for the female population. The benefit is COVID-19 cases prevented 8,500 cases, and it is higher than in the male. Hospitalization prevented 183. ICU admissions prevented 38. Death prevented 1. The harm, expected myocarditis cases from 8 to 10 in the female population per million vaccine doses. And that's it. And since October is Health Literacy Month, so I hope the information that was provided in this presentation helped in a way to improve our health literacy regarding COVID-19 vaccination for children. And thank you for listening.